Good evening, everyone, and welcome. My name is Megan Masacci, and I am honored to be your moderator for tonight's conversation. We're here to discuss the Beyer Family Skin Cancer Prevention and Control Initiative. This program is so important because it is dedicated to reducing the impact of skin cancer in our community through research, prevention, and patient care at the Sylvester Comprehensive Cancer Center. And this is only made possible by the incredible generosity of an extraordinary philanthropist, Tony Beyer. Thanks to Tony's commitment, Sylvester is reaching more people, developing more advanced therapies, and building a future where fewer families will face the challenge of skin cancer. And also joining us tonight are two of Sylvester's leading experts in this fight, who I am blessed to have the opportunity to work alongside: Dr. Jose Lutsky, Director of Cutaneous Oncology Services at Sylvester, who is advancing innovative treatments for melanoma and other challenging skin cancers, and Dr. Natalia Jaimes, Assistant Professor in the Dr. Philip Frost Department of Dermatology and Cutaneous Surgery at the Miller School of Medicine, who is leading community-focused efforts to promote prevention and early detection. Before we begin, let's go over how you can participate in tonight's conversation. You will have the opportunity to submit questions during this program. Please use the Q&A feature at the bottom of your screen. And remember, all questions are submitted anonymously, and we'll get to as many of them as we can. But before we get to those questions, it is my honor to introduce Tony Beyer. Tony?
Thank you, Megan, for the kind introduction. Good evening, everyone. Thank you for being here and for your interest in supporting skin cancer prevention. For me, nearly 5 years ago, I received a diagnosis that no one ever wanted to hear, which was that my melanoma had spread, and the odds were certainly not in my favor. I was given less than a year to live. In that moment, my life and the lives of those I loved were forever changed. And after seeking treatment elsewhere, I eventually found my way to Sylvester and Dr. Lutsky. And I cannot say enough about the incredible care I received from Dr. Lutsky and the entire Sylvester team. From day one, they treated me with compassion, skill, and a level of dedication that gave me the strength to keep fighting. I'm here today, healthy, in remission, because of their commitment and expertise. Sylvester did not just treat my cancer, they gave me hope and a chance to continue living the life that I cherish with my family. It's that gratitude and faith in Sylvester's mission that has driven my family, Vanessa, my wife, and myself, to establish the Beyer Skincare Prevention and Control Initiative. And we want to support the work that saved my life and make sure that it's there for others in our community. This initiative is much more than just treating those who are already affected. It's about helping people to take steps to prevent skin cancer in the first place. It's about reaching our friends, our families, and all those at risk to educate them, screen them, and protect them. My hope is that through our combined efforts, fewer families will have to face the fear and uncertainty that mine did. And I want to thank each and every one of you for being here and considering joining us in this very important mission. With that, I would like to invite my friend and my physician, Dr. Lutsky, for his remarks. Thank you.
Thank you, Tony, and welcome all. Thank you for joining us to learn more about the Beyer Family Skin Cancer Prevention and Control Initiative. Through the generosity of Tony Beyer and his family, this initiative supports Sylvester's commitment to advancing research and prevention strategies for skin cancer, particularly melanoma. At Sylvester, We're dedicated to pioneering new treatments and clinical trials to improve outcomes for patients facing this challenging disease. Our recent National Cancer Institute designation renewal cements Sylvester's role as the only NCI-designated cancer center in South Florida. Among the many advantages of that designation is access to clinical trials that are only available at an NCI center. Along with philanthropic support, like that of the Beyers, this allows us to push the boundaries of what's possible in cancer care, providing us with critical resources to develop innovative therapies and gather preliminary data for larger research grants. I'm excited to answer your questions about our research and the impact of this initiative. And with that, I'd like to introduce my esteemed colleague, Dr. Natalia Jaimes, who leads our prevention and education efforts as part of the Beyer Family Skin Cancer Prevention and Control Initiative.
Well, thank you so much, Dr. Latsky, and thank you all, each one of you, for being here today. It really means a lot. And we all know how skin cancer is the most common cancer worldwide, and it remains one of the most pressing health concerns in Florida. And we know that we here have one of the highest rates of skin cancer, of new melanoma cases in the country. The Beyer Family Skin Cancer Prevention and Control Initiative enables us to tackle this issue from multiple angles. And the beauty of it is that it allows us to really target prevention as an umbrella, like all the prevention as a whole, which includes education, screening, early detection, community engagement. So if I were to be in a simplistic but ambitious way to say it, our goal is to reduce the number of skin cancer, in particular melanoma. And how? Well, we really want to work in the core, in the root, or in the base of where we know we will be really doing an impact in order to reduce those skin cancer, to detect it early and maintain those healthy behaviors. We want to encourage persons, families, the communities to really adopt protective habits such as sun protection, seeking the shade, check their skins, and understand that is not others that are doing for me, that I am part of my own care, self-care. And that's what we want to bring out, to really reach every person, and also not only persons and families, but also we want to work with other healthcare professionals and non-healthcare professionals, from primary care, hairstylists, anyone that has what we call our frontline professionals, to equip them with the knowledge they need to play a role in early detection and prevention. So through this initiative, what we are doing is really building a strong foundation for long-lasting positive changes in our community. I am so happy to be here. I'm eager to answer all your questions. I hope we have enough time to discuss how we can continue working together to reduce the impact of skin cancer. And just let me highlight the word together, because that's key, because together we're stronger and we can push things much farther than just walking by ourselves. So back to you, Megan.
Thank you. Thank you all. Thank you, Dr. Jaimes, Lipsky, and Tony. And Dr. Jaimes, you touched on this a little bit in your remarks, but if you wouldn't mind just extending a little bit on what exactly the Beyer Family Skin Cancer Prevention Initiative is, and also what are your long-term and even short-term goals for the initiative?
Well, if I'm just gonna be like me, for me is like a dream coming true, because it's really the beginning of something big but transformative. It's really a seed of hope, as Tony also mentioned, one that I'm very confident will facilitate us to make meaningful impacts on countless lives, families, on the society, as a society as a whole. This initiative, I think, is the vision of those who, like Tony, believe in the power of prevention and understand how it can really create lasting, real changes. And this is exactly what we need for our world and future generations. So this initiative, what we aim with this initiative is reach far beyond as we as physicians can do in the clinic, as the one-to-one. We want to reach as many persons, community, society, starting obviously from our South Florida community, but really reaching out. We really aim to reduce the incidence of skin cancer through proactive education, and probably we'll touch about that. Early detection, we want to reach out there and get community engagement and partnerships. We want to empower individuals, societies, communities with enough knowledge about sun safety, early detection, know your skin, self-skin examination, regular screenings, so that we can foster each person their healthier communities and really save lives. So you touch some other points that we are mentioning about prevention, and those really key points. Maybe when we are talking about prevention, many of us may think prevention is just avoiding, blocking something from happening. And really prevention is more than that. And that's the goal of this initiative. Prevention is a spectrum. It goes from all the ways from health prevention to what we call tertiary prevention. And I don't want to get everyone bored at this time of the evening because I know we have many questions, but I think it's important that we all understand the definitions and terms in a very, I hope, easy way. So I just kind of run down, and that way I can point out some of the activities that we are planning, that we already started, that we are launching in that. So when we talk about prevention, is, as I say, like an umbrella, health, a spectrum. And we start with health promotion, that sometimes they put it together with primary prevention, but basically health promotion is basically what it aims is to prevent known risk factors at a population level. So it's about empowering persons, communities to take control of and improve their health overall, not just avoiding specific diseases. Actually, there is a very nice definition from the World Health Organization that you can look then, but I'll just kind of bring some of the words that I recall, is health promotion is the process that enables people to increase control over and improve their health, to reach that state of complete physical, mental, social well-being, and is therefore as health is a resource for everyday life, not the objective of living. And that's very important. And it's not just the responsibility of the healthcare sector. It goes beyond that. So it includes everyone, healthy lifestyles to well-being. So I think that's very important to really start with health promotion. So if we are talking about skin cancer, and we are saying that health promotion aims to prevent known risk factors at a population level, well, many of you now think, oh, ultraviolet radiation, sun. But here is not the sun. The sun has many benefits. It's what we do with that. So sunburns, exposure to that ultraviolet radiation is really the risk factors. It's not the sun. It's what we with that. And not surprisingly, that's what all foundations, associations, initiatives, campaigns are doing. Teaching everyone some safety, some protection, what you do. And this is going to be important because we want to do that, but we want to address it a little bit different. And here's the thing. If we go to our nice beaches right now, we see a lot of people tanning, right? Or you go to the schools, how many really kids are wearing a hat or sunscreens, right? So when we really tackle that, we see there is a gap, and we want to do that gap. So just because we have the information, more knowledge, more awareness, it doesn't mean that we are actually doing it. So that's changing behavior, and that's where we really want to make an impact. So just to mention, what we want to do here is really stick and try to make changes and health promotion with the groups, I start by levels, childhood, young teenagers, where really we start sticking like the information and changing behaviors, like what we do with our seatbelts. Now we get in a car and we put our seatbelt. So we want to do that with children, and then teenagers, a challenging age, but we're good to start with them. So we have many on that. And then I'm talking a little bit more, but I'll finish with that. Primary prevention is also aims to decrease the incidence of those that are at higher risk, focusing on risk factors and causes. So it's kind of together with that. Secondary prevention is about early detection, treated early. And then tertiary prevention is about preventing progression and recurrence while addressing complications and health-related quality of life factors. So with these two groups, we are focusing on what we call frontline professionals, which are in the healthcare and non-healthcare. So teaching them knowledge how they can also use their professions in early detection. So hairstylists, let's say massage therapists, primary care physicians, pediatricians. So we have everyone, not necessarily dermatologists. And then we will start with patients with melanoma and their family, first degree family members, to also start workshops and things that they can become spokesperson about that. So it's very summarized. I want to spend all time, but I know we have more questions, Megan. So very briefly, I just I want to keep talking and talking, but it's your turn now to talk.
No, you're fine. You can tell you're passionate and very eager to get this initiative out there, and I'm very excited about this as well. And Dr. Lutsky, maybe this is a question you can answer for us. This has come through on the chat actually quite a few times. Everybody talks about the importance of, sun prevention and sunscreen, staying out of the sun, but then there's also the reciprocal of a little bit of vitamin D. What does that look like for us here in South Florida? What does it mean to be vitamin D deficient, and what would help us if there are any type of supplements out there that would help us with that vitamin D?
Yeah, it is surprising that actually in Florida there are a number of patients or a number of people with vitamin D deficient. I think we've spent a lot of times indoors. It's very hot. We want to be with the AC, and maybe our exposure to the sun is unfortunately very brief and intense, and that's the type of exposure that's not so great for skin cancers, but may not even give us enough of the vitamin D that we need. The recommendations are, number one, you want to check the level of vitamin D. I would not just start supplementation without actually checking if the person is vitamin D deficient. And then the recommendations are 2,000 units of vitamin D3 daily, or 5,000 units weekly. Maybe Dr. Jaimes has some more information on that subject. What are your thoughts on vitamin D, Natalia?
So that's always a question that comes up. Obviously, you say, like, oh, if I use this, then I won't get it. So it's important to know that, as Dr. Lutsky is saying, we can supplement it. So there are supplements, but we have two sources of vitamin D, the skin and also food. So we need to have fortified foods and supplements. We know vitamin D is essential for immune health, and we have vitamin D like certain dairy products. We have plant-based milks, we have cereals, we have the supplements as Dr. Lutsky was saying. But the important thing is that you don't need to really go and tan for hours to really get your vitamin D. 3 times a day, 10, 15 minutes, what you take walking to your office maybe, or a block. So it's not that you need to intentionally go and tan to really get those supplements. So it's kind of knowing that you are getting it from both sides. So obviously it's healthy diet, if not the supplements, and the sun is obviously with moderate.
Yeah, and Dr. Jaimes, to that point, one of the questions that just came in is, does food intake affect your risk of skin cancer? Any type of food intake?
Well, I would say, we cannot say like, if you eat this, you'll get that. But overall, we know that diet and nutrition can influence not only, I mean, many issues in health, skin cancer, risk, progression, whatever is, and it's the overall message is that we want to have a good antioxidant and protective compounds in your diet. So how they teach the kids rainbow, and so balance. So we want to fruits and veggies that are rich in antioxidants like vitamin C. You want a vitamin E, the the polyphenols, and you can find that. So those help us protect the skin from UV damage by neutralizing all those free radicals. So that's why they're antioxidants. So you'll find it in the berries, all the citrus fruits, carrots. You can get leafy greens, the green ones, and that will help you support the health of your cells, of your skin, and reduce the DNA damage. We can continue talking then all the lycopenes like tomatoes, watermelon. Also, it's going to be good for your skin, reduce the risk of sunburns. And actually, there are some supplements that are made of plants and all those things. Green tea also could help you protect skin from UV damage. It's not like if you're going to get, then you don't need to use your sun protection. No, but obviously it's a balance, right? Omega-3 fatty acids also, I mean, fish, nuts, salmon, anti-inflammatory properties. And we know how every day we learn more that we need to counteract that inflammation in your skin overall. So if you get sunburn, you are producing inflammation. If you eat a lot of alcohol, processed meats, sugar, you are creating inflammation. So omega fatty acid will counteract that, protect your and your health overall. Vitamin D, we already spoke. Well, so the not good ones, alcohol, processed foods, sugar. So it's kind of maintaining that balance, and for sure that will be a healthy overall diet and things that will help you with your skin and health overall, plus drinking water, hydration, and that will also help you with your health overall.
Exactly. Thank you. Thank you for that. And another question that just came in as we were talking, maybe Dr. Lutsky can speak on this. Many dermatologists here in the US freeze off many spots on our bodies. Is this something that is actually necessary? They have found when they've gone to other countries, they examine the spots more before just zapping them off.
Wow, that sounds like it's a question for a dermatologist. But I think there are different patterns of practice in different countries, and again, I will pass this to Dr. Jaimes, but I would think that spots that are frozen are spots that the dermatologists judge are not serious or dangerous, and they may do that maybe because they're insightful or patients want them out. That may be why, but Dr. Jaimes.
So Mega, the question was, why do they?
Why do they freeze them?
Well,
why do they freeze?
So in theory, when we check, so I'll speak by myself, and I guess all the physicians that you kind of, when you are in your clinic and your patients, once you are sure something is completely benign, you name it, a seborrheic keratosis, a wart, something that is uncomfortable or other reason, then we can freeze. Or if it's what we call an actinic keratosis, also produced by the sun, we can freeze. But we decide what to freeze based on our exam. So clinical dermoscopy, okay, fine. I'm sure that it does not need to be biopsied and sent to path. So after being 100% sure, at least for myself, that it's an equivocal lesion, that it's okay. So I'll just freeze it.
Wonderful. And to piggyback on that same question in terms of screening, with the way the world is changing today with AI, is there any chance that a scanning machine or anything with AI will help diagnose a melanoma or skin cancer before the actual look of a dermatologist?
Definitely. I mean, and that's where the world is going and the research is pointing. But I would say it's AI is here to really assist us. So it help us help us in some decisions. Obviously, there are other technologies for the patient use, for the dermatologist or the physician use, and we know how it is helping us in those decision-making processes as to whether or not biopsy something.
Right. That kind of goes into one of the last questions we just got. What progress are we into making a diagnosis without an actual extraction or a biopsy?
We're not yet there, and we are not yet there. It assists us in deciding we need or not to biopsy, but once we biopsy, pathology is still the gold standard, and we need it for tissue to plan, to diagnose, to stage the patient, because it gives us a lot of information. So it goes or stays only in dermatology, or now we'll need to move to oncology or the surgeon or whatever, and it helps us stage and plan the treatment.
Wonderful. And another live question that has come in, does having Lynch syndrome make one at a higher risk of developing skin cancer?
Yes, that and other syndromes predispose some patients to have it more.
Yeah,
Okay, wonderful.
does increase the risk, yes.
So let's see, this was extraction questions. We still have a lot more questions here that we are going here. Dr. Lutsky, a question for you. What is the latest link between melanoma and breast cancer?
Yeah, so patients with melanoma some patients with melanoma have a higher risk of breast cancer, and some patients with breast cancer have a higher risk of melanoma. There may be a number of factors that contribute for that. For example, we know that patients that have a BRCA mutation and have breast cancer related to BRCA mutation have an increased risk because BRCA also predisposes to melanoma. Patients with melanoma, they have one of these inherited mutations, the CDKN2A mutations. Those patients have a high incidence of melanoma, but also have a higher incidence of breast cancer because these are mutations in genes that control cell growth. So it's not really surprising that that happens. Also, young patients with melanoma have a higher risk of breast cancer. They seem to have a higher risk. In patients that are treated for breast cancer with radiation, the radiated areas have a higher risk of melanoma as well. So it may be a number of superimposing factors that cause this association. And finally, if there's a family history of breast cancer and melanoma, that those patients also are at higher risk. There are factors other than the genetic factors that are responsible for this association.
Thank you, Dr. Lutsky. And Dr. Lutsky, another question for you. What is the state of medicine regarding immunotherapy treatments for melanoma right now?
Well, immunotherapy, specifically with the type of immunotherapy called checkpoint inhibitors, revolutionized not only melanoma, but all of oncology. We always say that cancer treatment has several pillars, right? So the first pillar was surgery, then came radiation therapy, then came chemotherapy, then came what we call targeted therapy. There are drugs that specifically target certain mutations. And then immunotherapy is now the fifth pillar of immunotherapy. I was just looking at the data the other day. About 5 years ago, only about 500 patients at Sylvester were treated with immunotherapy. When we look at last year's data, we are 2,800 patients being treated with immunotherapy for not only melanoma, but all kinds of malignancies. There are actually very few malignancies now that for which immunotherapy is not indicated. In melanoma, we have moved along. We were ahead, and we continue to be ahead because we started earlier. So there are new combinations that are being tested. One of the areas of immunotherapy in melanoma that's very, very exciting is the area of cell therapy. Things like TIL, which is tumor-infiltrating lymphocytes, in which we take out the lymphocytes that are the fighting cells from patient's tumor and give it back to them after cleaning the body from the suppressive factors. And also, even more exciting than that is just taking these T cells, these circulating T cells from the blood of these patients, and then engineering them, do molecular engineering to make these cells attack the tumors, attack the proteins that these tumors have that we have detected in the the tumor. So those types of approaches are really very active right now. We're seeing a lot of exciting results. The other area is vaccines. Okay, so vaccines, cancer vaccines have been a promise for, I say, the last 30 years and never panned out, but now it has. Now we know a lot more about melanoma. We can actually make vaccines targeting the proteins of your specific melanoma, what's called the personalized vaccines. So there's a lot of progress, and there's a lot more to come.
Wonderful. Thank you, Dr. Lutsky. And on that same note, we've had a few questions come in about new procedures, about staying ahead of skin cancers, different ways to, say, battle melanoma once it's metastasized as avoid to cutting. Like, are there any new treatments that we're currently looking at?
Well, I think all of the above, are new treatments. Like I said, surgery, the role of surgery or cutting right now, it's really limited to diagnostics, primarily when we first discover melanoma. If it's early, we excise it and we check the lymph nodes. And sometimes when there is a recurrence, a metastasis that's localized in an area that is easy to reach, or we need, a diagnostic tissue, then we will do surgery. But a lot of times we won't. A lot of times we'll treat these patients with one of these immunotherapy treatments that I just mentioned.
Okay, wonderful. Thank you. Dr. Jaime, might be a question for you. These are a few questions I'm kind of putting together here, but people are asking about the damaging effects that things like mosquito spray or sunblock or different creams might have on their skin. Do you have any recommendations on the types of sprays and things that they should be using on their skins?
So, mosquito sprays, the potential damage or effects of those sprays on your skin will depend on the type of repellent that you're using and the active ingredients that are contained in that solution or the spray that you're using and the frequency that you're using it. So basically there are different ingredients, but the ones that are really out there, like there's one very common that is spelled like DEET, highly effective, and is usually safe. Usually if you are applying it, it's not like you're applying every day. Some people may experience like local reactions and irritation. So it's kind of reading the ingredients, and obviously there are some that are more for kids and that, but usually you should be okay. There are some that are not on the market, but usually most of them should be safe and effective. With the sunscreens, well, that one is if right now the ones that are approved by the FDA should be okay and without, let's say, much side effects. So if a person is concerned about something, absorption and that, so I would just recommend to use the organic ones, which are like the zinc oxide and the titanium dioxide. which are those two. So you just look in the ingredients and look for those. Those are basically the ones that are for kids and children. But now there are different molecules and they are better technologies and everything. So now you are not, those are where the ones that before they leave you like all white. So now its technology is better and you are not so white, but those are like the organic ones. And the ones that are like more, let's say, not the chemical ones. If now you're not so concerned, a good combination, I personally am okay with that. And I like it, they act different. So the mechanism of action is different. So that's also another option for that. Reactions on sensitive skin, so try to use the ones that are the organic ones. Those persons that have like red skin and that they put anything and they just break out. So probably use the ones that are more the physical ones, the ones that I was talking about, the two components, the titanium dioxide and the zinc oxide.
Wonderful, thank you. Another question that just came in. Do they still teach the ABCDs?
I love that. I love that question. So we all grew with the ABCDs, right? I personally don't teach it. And the reason is obviously, we also always like to go back in history. At the beginning, it was very helpful. I mean, now we were diagnosing these big tumors now with the ABCDs less, and now with dermoscopy less and less. But turns out that not all melanomas will manifest asymmetry, border irregularity, color variation, and not all of them are large. I mean, they need to start little and then large. So really for me, the best that we can teach patients and hopefully everyone is really get to know your skin. And having said that, anything that is new or changing, you want to bring it to the physicians or your dermatologist. And basically anything new, meaning something that was not on your skin appears and stays more than 3 or 4 weeks, regardless of the color, can be pink, brown, purple, whatever, or any other color. But if it's persistent and keeps growing, you want to notice that. And it could look like no ABCDs, right? And there are some melanomas, fortunately, they are not the majority, but grow very rapidly. And they do not have the ABCDs. So really knowing your skin and being aware if anything is new or changing, that will help. And changes anything, right? Changing shape, color, form, something that was flat and is getting raised. And obviously, not everything that is new or changing is going to be a melanoma or a skin cancer, but the other way around is true. So most skin cancers are new or changing. So basically, it's know your skin. And obviously, there are some patients that we are here to support with tons of moles. We are here to support, but even they can do it. So with help of images, pictures, but yeah, I think that's kind of the key, know your skin.
Thank you, Dr. Jaimes. And Dr. Lutsky, this may be a question for you. We've had a few questions on Mohs surgery. Are there other options that you think would be a more viable option for Mohs? People are seeing different things now advertised on the television, and they're just curious to see if there's something you think is anything better than Mohs surgery.
It is actually a procedure that dermatologists do. That dermatologists, they're specifically training for Mohs surgery. I think treating melanoma with Mohs surgery is a little bit of a touchy subject. There have been people on both sides, that the people that say that it's a no-no and people that say that yes, it can be done. I think the consensus is for areas that are cosmetically sensitive, that you can't really do a wide local incision, which is preferred. Mohs may be appropriate depending on the depth, depending on how it presents. But I will let actually Dr. Jaimes give us the dermatologist perspective of that.
So Mohs surgery, so let's say just kind of following with that for melanoma, yes, I agree totally with you. We'll just leave it for those melanomas on some skin, on the face, like that we need with immune stains. The rest, white local excision. But there are other skin cancers that originate in different cells, which are like the keratinocytes, like basal cell carcinoma, squamous cell carcinoma, and most still one of the first line therapies for those at high risk areas, face, ears. But yes, there are other options that it's all about the context, the patient, age, where was it, your medical history, what are your preferences, what do you want? So yes, there are other things that we can do for those non-melanoma skin cancers. You can scrape and burn, you can use some creams. You can also do like some light therapies. You can use radiation therapy. So it's all about the context. So it's not that we're just going to say this is for everyone. So I also always like to discuss with each patient because everyone is different. So, but yes, there are other options, but it will depend. But still, most surgeries, I would say, very used a lot, especially in those non-melanoma skin cancers.
Great. Thank you. Thank you both. Tony, this is a question that has come in for you. First of all, they wanted to thank you and your family for your incredible generosity to this amazing initiative. And the question was, what was it that impelled you to feel to do this initiative for Sylvester and specifically with the Skin Cancer Prevention Initiative and education?
I think the two things that compelled me, having lived through stage 4 melanoma, one that it's highly preventable, and so I think education and awareness is very critical. And two, when I was first diagnosed with melanoma nearly 5 years ago, I think the immunotherapies were just coming onto the scene, and I was very fortunate to have access to the immunotherapies. But before that, melanoma was pretty much at the stage I was at, pretty much a death sentence, and so I realized how important it is to if get behind critical research, the kind of research that Dr. Lutsky is doing right now. He has some fascinating research projects where he's made significant advancements in towards helping people with different sorts of advanced melanomas. So I think the research and awareness, and I think it's very critical to support both of those initiatives. And I hope that everybody listening tonight could do their best in supporting the initiative, and very grateful to have everybody on board tonight.
Thank you, Tony. And we couldn't have done this without you. We really could not have. And you touched on something that actually, as you were speaking, somebody typed in a question here talking about trials and talking about the clinical trials. How can somebody participate in a clinical trial? Dr. Lutsky?
Patients that want to participate in a clinical trial, obviously it depends on what their diagnosis is and what stage they're in, and they need to be evaluated by one of our physicians to see if a clinical trial is appropriate, right? We have clinical trials that are first line for the first types of treatments, but the vast majority of our clinical trials are for patients that have the standard treatment, which, as you just heard before, can be very successful, but there's still 40 to 50% of patients with melanoma, for example, that don't respond to the original treatment. So those patients need something new, and clinical trials come in. So we have a menu of clinical trials for all types of stages and and all types of skin cancer. And again, the way to get in is to be evaluated by one of the physicians and see if it's appropriate for them to get on a clinical trial.
Wonderful. Thank you. And this was going back to, we had a few questions come in. I think it was Dr. Jaime's when you were speaking about vaccines. Somebody had a question about what is the BCG vaccine and the RP2?
I think I can talk about the RP2.
Okay,
The
thank you.
RP2 is an oncolytic virus vaccine that is being currently investigated. And the two is because it's the second generation of this virus. RP1 was investigated in melanoma of the skin, and it showed that in combination with immunotherapy in patients who had not responded to immunotherapy or patients that responded and then progressed, there was 1/3 of the patients had a very nice response when they added this oncolytic virus. So oncolytic viruses are viruses that you inject directly into the tumor, and they not only kill the tumor, but they also engender a response from the immune system. So not only the areas that are injected, but also other areas outside of the injected areas can respond. So there's currently a large clinical trial with RP2, which is a second generation of this virus from patients with melanoma of the eye, at the back of the eye, ocular melanoma, and actually has shown some initial very good results with that. But again, it's still something that we're trying, and hopefully eventually we'll make it to approval by the FDA.
Wow, that would be incredible. And we're going to go on here to our last question of the evening. And Dr. Jaimes, I think this is for you. If someone has already had the risk of skin cancer or anything like that, and they're already putting out the risk, and they still want to go outside, what are the best hours for them to be outside? What are those hours, for how long, and what should they be doing to protect themselves during that time?
So I think it's not extremes, right? I always say that we're here to enjoy and have fun and do what you really like to do, and that really kind of will boost your energy. But it's just how you do it. So it's if you need to go out and just protect, and that's it. But obviously, if you are doing an exercise, you don't want, if you can choose the time, we'll do it early in the morning, ideally not at noon when the sun is kind of more intense. So in theory, the hours are between 10 and 4. And it's not that you cannot go out, just go on, just healthy behaviors, protect yourself, use your hat, your sunglasses, your clothing if you're out in vacation. But I always say, like, it's not, we are not recommended to go unintentionally tan or get a sunburn. And that's it. It's not extremes, to be honest. And obviously it's a chronic damage of the skin. So it's not what you did last week or last year. It's all your lifelong behavior. So obviously here is just enjoy, try to not, I know, and I talk this a lot with the patients, and I understand the anxiety that is behind it. And but trying to kind of just enjoy and have all with that, but without really getting burned. Do what is on your hands to really do, and enjoy, and go to your vacation and just spend in a moderate way, not intentional time, to seek the shade, wear your things, and all the healthy behaviors.
Wonderful. And we do have one more question that came through in our pre-registration, then again tonight. I want to make sure we get to it. Is total body photography recommended for those who are in remission observation after their initial treatment?
So the answer is yes. I mean, but we do total body photography, as its name says. There are two different ways of we can do it. There are 3D systems and 2D systems. And the reasoning behind that is to provide a more objective way of following you and your moles. So indications, patients who had a melanoma, but obviously the ones that really benefit of this are those who have multiple moles that we want to follow in time. So the short answer is yes, but obviously there is a group of patients that will benefit the most.
Wonderful. And now I have one more. I know I said this was like 2 questions ago, one more, but this one just came through again. This person is 5, excuse me, in my pronunciation of this, it's 5-fluorouracil an option versus surgical procedures for small areas of basal cell skin cancer on the face?
So that probably is very linked to the other questions that we were talking about most. So there are other alternatives. Maybe they are not the first line therapies for non-melanoma skin cancers, including basal cell, squamous, and those include creams, what we call topical therapies, including 5-fluorouracil, including imiquimod. So there are other options that we can do, and obviously there are some preference for squamous or if it's a basal. So after discussing with the patient that they know of the risk that it may not go entirely, can be persistent, or it may come back. So the answer is, I mean, yes, but obviously they are not the first line therapies, but obviously anything could be depending on the area of the face as well.
Wonderful. Thank you. And I believe that wraps us up for the question portion of the night, unless anybody else has anything they would like to throw in there now. We have a couple minutes we'd happy to answer, but otherwise I will let Dr. Letsky take it from here.
Okay, well, thank you all for joining us today and for your interest in the Beyer Family Skin Cancer Prevention and Control Initiative. I want to express my deepest gratitude to our donors and community members. Your support enables Sylvester to push the boundaries in skin cancer research, patient care, and prevention. Philanthropy is essential to our work. It allows us to make real progress in developing better treatments and expanding our outreach to prevent this disease. So together, we're making a lasting impact, and we're truly grateful to have you as partners in this mission. Thank you very much.
Thank you, Dr. Letsky, and thank you all for attending tonight's conversation. Tony, we could not have done this without your support, and we've had so many people remark that tonight. Everybody is thanking you and your family for everything you have done. Everyone, please remember that a full recording of this program will be posted online, and look for an email with a link in the coming days for the video that you can see. And in a moment, you will see a short survey about tonight's conversation with an opportunity to alert us if you'd like to get more involved in the Beyer Family Skin Cancer Prevention and Control Initiative. Take a minute to submit your feedback and interest in the program. We wish you and your family good health. Thank you and have a wonderful night.